We're the only pediatric trauma center in Northern California, so we get the worst trauma cases regardless of where they come from and regardless of why they became injured. Probably about half of the really badly physically injured kids, the kids in the ICU, that come in with issues related to physical assault are from away. So these are kids that come by helicopter transport from Mendocino County or Lake County, from far away. We get about a dozen children a year who die from their injuries, who come and don't survive. We have probably 2 or 3 times that who are admitted and physically survive, but their brain injury is so profound that they will clearly never be the person they should have been, whether it's cognitive issues or motor skill issues or other kind of problems. We see about 1,000 kids a year. So about 50% of the kids have issues related to sexual assault and 50% have issues related to physical assault. A big piece of those 1,000 kids are children who come in for long-term therapy with some of the therapists in the department. Right before this, looking at an x-ray of a baby who was 13 days old, and we've seen, not a lot, but I've seen a small number of young adults, maybe in their 20s, early 30s, who have some significant developmental delay, where sexual assaults have happened, but they're wouldn't do very well like at a large adult hospital. So because of the circumstances, they've come here for care. So even though they're chronologically a lot older than a lot of my kids, from a developmental standpoint, they're actually a lot younger than a lot of my kids. Most of our kids are through adolescence. I see a lot of kids that have been referred for lots of different reasons. The most common are children who have made statements about sexual assaults, that things have happened that obviously shouldn't have happened, who are referred typically by law enforcement for forensic medical evaluations. And we work with the kids and with their families to help them get past this particular moment in time. From a medical standpoint, I do my best to make sure that they understand that no matter what's happened to them, that they're okay. A lot of these kids walking down the street, they have this sense in their mind that something changed because of whatever happened, and they think that other people can tell just by looking at them that something happened to them. They think they look different. What I can hopefully do is help them understand that that's not true, that they look okay, that they look the same as they ever did, and that they look the way that they're supposed to. We can, from a medical standpoint, make sure that kids are okay with regard to possible infections, pregnancies. We definitely have little kids who have gonorrhea and syphilis and are pregnant, and we can figure out what we need to do to take care of them with regard to that. Part of what we do is we work with the kids and the families to respond to the crisis. So we have a lot of people who are available to do crisis counseling and kind of getting them through the moment of, it's every parent's worst fear, realized when their child tells them that something like that happened. So we can help, moms and dads, usually dads, not go out and get a gun and shoot somebody, and that's actually happened, where people just are so enraged by what they've learned that they respond to it really violently and aggressively. From an on-call standpoint, we have something called the SAFE team, which is the Sexual Assault Forensic Evaluation team. And the SAFE team provides, or really ensures rather, that my department is able to provide 24-hour-a-day coverage for children who need acute medical evaluations. They present at 2 in the morning on a Thursday. Somebody from my department is available to come to the emergency room within an hour and be there to take care of them from a medical standpoint. Therapists who do individual and group therapy here at the hospital, and they've seen a number of patients for short and long-term therapy, group therapy, things like that. We've got a number of therapists who are out in the community working at different schools, middle schools and elementary schools, doing both education as well as therapy on site. I mean, they said, why do you rob a bank? That's where the money is. Why do you have therapists at school? Because that's where the kids are. Doves Project, which is our domestic violence education and screening program, and we've got 2 therapists who work with Doves, working to address issues of domestic violence in kids and families that present here at the hospital. The fear most people have is that somebody that they don't know is going to kidnap their child or break into their house and do something terrible. And that does happen, but it's thankfully very uncommon. The reality is that most people who do things to kids that shouldn't happen are people who know kids. They're the people who have access for whatever reason, families, friends, extended contact through school or sports or whatever. And they take advantage of that relationship, and they, as the adults, they do something that they shouldn't be doing, and it's because of their quote-unquote legitimate access to the children that they are able to be in a position to do that. One of the realities about when children try to tell parents what have happened is it's very difficult as a parent to hear this type of information, and unfortunately a lot of times we don't want to hear it because it's so terrible to hear, and we send messages or we respond kind of in a reluctant way, and kids may stop the disclosure. They may not continue to say what happened to them. If a child does tell today, what made today different? Why could they say something today about something that's been going on for 2 years, which is a not uncommon time frame. And sometimes we never figure out what that is, but if we can figure out what allows a child to have the strength to say today what's been going on, maybe we could move it back so it's not 2 years, it's a year or 6 months or 6 weeks or 6 times, and make it not happen anymore. In sexual assault cases, the kids who come here, in virtually all the instances, are kids who are defining themselves that something inappropriate happened. So they've come here for assistance, basically, already knowing that something bad happened. They are defining that something bad happened in the course of their disclosure. With physical abuse cases, it's a different dynamic. In contrast, I guess, to the children who come in saying that they have been sexually assaulted, where we are responding to that statement. In children who have been physically abused, usually nobody is saying, prior to us identifying it, nobody is saying, I think somebody hurt my child. I think somebody broke my child's ribs or caused a head injury. So the response, depending on who's being identified by the outside world as doing it, can be it's very traumatic sometimes, very often, for families to learn the nature and the extent of their child's physical injuries. Again, particularly if they truly had no idea of what caused the injuries to be there. I think I do what I do mostly because it needs to be done. I wanted to wake up the day before I died when I'm 97 years old and ask myself, would I do it again? Did I do something that that I didn't think was a waste of my time? And I want to be able to say yes, that I'd do it again.